Good afternoon, ladies and gentlemen. We have such a very, lucky and wonderful chances to be able to have Dr. Choi in Kwon from Korea to be, able to talk with us about how to make, beauty with the botutoxin, which is the very latest, just launched by the Thai FDA very recently. I'm just started to know about the, botutoxin, just very, I think it's less than 1 month that I just started to know the toxin. But anyway, before getting started, I just like to say a little bit of something, for the introduction of the speaker, right? Our fellow from Korea. Dr. Choi In-kwon he graduated from the Medical College of Seoul National University from Korea. He actually completed his plastic surgical course as a postgraduate research from the Seoul National University, University Hospital and School. He used to be the PRS, plastic reconstructive surgeon, right? Plastic reconstructive surgery consultant doctor for the Korea Medical Research Organization, and also used to be the chief doctor of Best Choi, right? Best Choi, I say it right? Best Choi PRS clinic, and used to be the director of the FA hospital in Jeju Island. Jeju Island sounds very familiar. Maybe Swamp Sound kind of Korean series yeah, Jeju Island, Korea. And you are now the PRS consultant also, PRS Plastic Reconstructive Surgeon Consultant Doctor of the Medical Tour Corporation in Incheon, and the Chief Consulting Surgeon for Seiyuan Plastic Group. Okay, Hospital Consulting Surgeon of Yonsai Dermatological Clinic, and many others. Okay, so in order for us to be able to talk longer, I'm gonna, cut my part short and then, pass the time to Dr. Choi so that you can start your presentation right after. And briefly after the presentation, it's gonna take for approximately half an hour, I guess. And then we do the live demonstration after that. It's gonna be 4 interesting different cases. Okay, please welcome Dr. Choi. Thank you very much.
Welcome everyone in this room, ladies and gentlemen, and the members of the dermatology department. I'm really honored to present my case and experience about the future toxin. Okay, this is me. As you know, I'm plastic surgeon. So I think today we'll have a very interesting discussion because I'm a plastic surgeon, you are a dermatologist, so we have different idea about Botox cases, right? So today, I'll make the presentation time shorter and the discussion time longer, if you don't mind. It's okay? Okay. Okay, this is the Huger toxin and also the Botox toxin. As you know, the Botox toxin is produced by these bacteria. It's a difficult term, Clostridium botulinum bacteria. Anyway, it has 7 serotypes. Among them, 8 is most potent. So that's why most Botox companies use a 8 type toxin. It blocks acetylcholine release from, okay, wait a second. Presynaptic nerve ending, and subsequently it blocks and paralyzes the muscle. But 3 or 4 months later, the healing process is going via at original site. This picture is a little wrong. Anyway, the spark action will disappear as the healing process is going on. Microphone okay, it's much better. The Huger toxin has 2 characteristics. One is it used it's kind of electrophoresis. It don't use any DNA RNA and RNA analysis. That means it has less endotoxin levels. And the second is it uses freeze drying system instead of a vacuum drying with heating system. That means it has no chance to be denatured by heating system. Anyway, it has two characteristics. According to this article, the freeze drying system is much better than vacuum drying system. This slide shows the usual toxin is produced by the freeze drying system. I'm not cyber savvy, so sorry for that. Okay. Okay, in this video clip, we can see usual toxin is completely automatically produced without any human intervention in sterile condition. Anyway, it's kind of an advertisement. Okay, it is not important video for you. That's okay. No. Okay. After dilution, whether it's kept in refrigerated condition or in frozen condition, there is no actual difference in potency. Even within 1 month, the potency is as strong as newly opened vial. So usual Botox toxin is a freeze dried Botox, and also it has even potency within an FDA standard, and also usual toxin is by far less endotoxin level than FDA standard. Okay. And also the shelf life is as long as 36 months. Okay, so usual toxin potency is well regulated and has a long and also strong enough for each patient, even though it's a 50 unit. So usual toxin can be used in clinical cases, in cosmetic ways and therapeutic ways. Okay, in cosmetic ways, it includes removal of wrinkle and to get a natural appearance, and also to get a reshaping or contour. In therapeutic ways, hyperhidrosis, Frey syndrome, Bell's palsy. But today I'm going to mention only hyperhidrosis. About the dynamic line, there is so many entities here. Okay, this is for the wrinkles. Usually needs 6 to 8 injection sites. Each injection site two cm apart from each other, and also it's 2 cm above eyebrow. Its target muscle is frontalis muscle. This is for crow's feet, and this is for infraorbital wrinkle, called crippled paper. The injection site for crow's feet 1.5 cm away from the lateral canthus, and the yellow dot is for crippled paper. The injection site not one point. It's 0.5 away from the ciliary margin of lower eyelid. This is for glabellar line. This is for the bunny line. For glabellar line, you first draw the line from the medial part of the eyebrow to the the opposite metal contours. And also you draw this the same way. The yellow dot is a cross point of two drawn lines. And also this is a dot along the upper part of eyebrow. The yellow dot means usually 4 or 5 units. The blue dot means 2.5 units. This is for a bunny line. It usually 2 or 3 units. The target muscle it's too long. It's a levator labii superius arachnoides. I always difficult to remember this muscle. Too long for me. This is for perioral wrinkle. It usually needs 4 injection sites. Each injection site needs only 0.5 because it's only for partial paralysis, not full paralysis. It's only for partial paralysis. Remember that. This is for neck band. Neck band is usually 3 or 4 injection sites. Each injection site needs 4 units. Okay, this is the injection site for neck crease. Each injection site should be 2 cm apart from each other in alternating way along the crease, and also each injection site needs 2 units. Remember, around the neck area, don't shoot deeper than intradermal layer. If you do that, your patient might have some difficulty in swallowing or breathing. This is for natural appearance. It includes the gummy smile, medial line, pebbly chin, and the tip augmentations. Okay, this is for gummy smile. The injection site, 1 cm lateral from lateral nostril shield. This picture is a little wrong. Okay, anyway, it is not important. The target muscle is the zygomaticus major and minor. Sometimes it is levator labii superius. Well, it is only 1 unit because it's a partial paralysis, not full paralysis. Okay, this is for medial line. The target muscle is the depressor angularis muscle. The injection site 1 cm from lateral, 1 cm below from the lateral corner of mouth. Each injection needs 4 units. This is a pebbly chin injection site. The injection site is 1 cm from the midline and the midpoint between the lower lip and the bottom of chin. Each injection site 4 units. Okay. This is laser tip augmentation injection site. I'm a plastic surgeon, so honestly speaking, I prefer rhinoplasty to Botox injection or the filler injection. There are 2 ways for injection. One is injection on the bottom of columella or base of columella, and the other is injection to upper part of columella. I prefer the upper part. Okay. This is for reshaping or contouring, and there are many entities for that. About arm tightening, and actually I have no experience about and any information about that, because I prefer liposuction or AccuLift for arm tightening instead of a Botox injection. This is a masseter muscle injection site. You draw the line from the lateral corner of mouth to earlobe, and also you draw the along the anterior and posterior mandible, the posterior masseter muscle, and also you draw the inferior border of the mandible. This is called the safe zone. Each safe zone needs 3 or 5 injection sites, and also 25 units at each side. I prefer 5-10-10 technique. Okay, according to this article, the optimal interval between the injection is around 5 or 6 months. And also, the muscle therapy started around 1 month and it maximized the third on the 4th month. Even though you repeat it again and again, you can get the never permanent effect. So to plastic surgeon or to dermatologist, if you have this patient, it's kind of a permanent life saving in your bank, you know. Okay, this is a curved muscle hypertrophy. 4 injection on the medial gastrocnemius and the 3 injection on the lateral gastrocnemius. Sorry. Each injection sizing is 10 units. Okay, this is for trapezius injection. Well, this is wrong. At the first time I injected 25, but it was too much. So my patient complained about arm raising difficulty. So I adjusted 15 for woman, 20 for man. So that means each side, 3 units is required for woman, 4 units for man. As you know, you can see the eccrine gland in the dermal layer. So intradermal injects prepared to subdermal injection. At each side, 50 units is enough. Okay, this is only for demonstration. Anyway, applying the starch and iodine test, you can outline the sweating gland area. But in a real setting or in clinical setting, just cutting the hair short is enough to outline the sweating gland area. Anyway, it's just for demonstration. Okay, this is time to check the real cases, okay? These 2 patients is forehead wrinkle cases. One is 1 week and the other is 6 weeks. You can see both cases a good result. This is another forehead wrinkle cases. I think you have something to ask about these cases. Anyway, you can see a mild side effect of forehead wrinkle, you know. You can see the spark eyebrow deformity. Usually in this deformity, it is easily corrected by additional injection on peaked area. I usually 0.5. This is lateral cross cases, you know. Around 1 month you can see a dramatic change, but 4 months you can see some relapse change, relapsing change. This is another crossfit. Well, those 2 patients are relatives. This is infraorbital wrinkle cases. You can see some change. Okay, this is frontline cases. I used Botox and filler simultaneously. Okay, this is a bunny line cases. I used the 10 units. 4, this one, and the 3. This is a parallel wrinkle cases. This is a rest status. This is a pouting status. This is a neck bend cases. This is a neck crease cases. Remember again, don't shoot deeper than intradermal layer. Okay, this is a gummy smile cases. Inject here. Okay, 1 unit. Just only 1 unit. This is another interesting case. This is Mario line. Usually Mario line develops in old age group, but she is a young age group. She's young. Anyway, she is cured. This is a Fibrogen. This is a lip tightening case, the lip tightening status, and this is a smiling status. Those are different patients. And this is a resting status. Three are different status per patient. Okay, for muscle hypertrophy and capital hypertrophy, and then and long line. Okay, this is muscle hypertrophy. In 1 month, you cannot see a significant change because it needs some time for muscle atrophies. But 4 months you can see some change. Okay, and this is another masseter cases. This is calf muscle cases. 1 month you cannot see any significant change, but in 3 months you can see some change. There is a muscle version contour, there is no muscle version contour. This is the same patient. This is another interesting case. As you know, it's only 2 weeks. But you can see here muscle contraction belly, but there is no muscle belly contractions. Also muscle belly contraction, there is no muscle belly contraction. And also same. Okay, this is trapezius cases. I mentioned earlier, 3 for men, 3 for women, 4 for men. 4 units for everyone is too much. Okay, this is hyperhidrosis. It's compounded by iodine starch test. It's a dramatic change in the sweating glanding area. Okay, before conclusion, remember there is no Bible or textbook on Botox cases. It totally depends on your experience and patient condition. Remember that. It can be changed depending on the patient's situation. Okay, anyway, my bottom line of Hugel Botox is I can get a good clinical result with Hugel toxin, and I think I am totally convinced the Hugel toxin is one of the most reliable and the safest toxin. Thank you very much. Kokonka.
Once again, thank you very much for your wonderful presentation. ก็เท่าที่เราเห็นนะครับก็จะเห็นว่ามันใช้ได้หลายดีเลยใช่ไหมแต่ส่วนหน้าคอนะครับแล้วมีเชฟที่ไม่หลายร่างกายนะครับ At this point, I like to welcome any questions from the floor. คุณหมอท่านใดอยากจะถามอะไรเพิ่มเติมนะครับ And next, after the question, the Q&A, we are going to proceed to the live demonstration of 4 different cases. Okay. มีใครดูสนใจถามอะไรเพิ่มเติมไหมครับ
Okay, if you have any discussion or something to ask, feel free to ask.
Okay, the first question is from the lady up front. She's asking about how to do the injections for the gummy smile. Can you point it out?
Gummy smile?
Injections.
Okay. The gummy, you mean you're asking the gummy smile injection site, you mean?
Yes.
Okay. The gummy smile injection site is, wait a second.
Like how far this is like above the upper lip.
Well, the amount of Botox and the anatomy of a Botox is not a textbook, It's not a Bible. It depends on patient situation. Okay, this is a gummy smile. Okay. The gummy smile, the injection site is 1 cm lateral from lateral luster seal. It's a picture is a little wrong. So this target muscle is 1 cm, just 1 cm. 1 centimeter, 1 centimeter.
The upper lip.
Yeah, no, 1 centimeter from lateral luster seal. You draw it horizontally. And the target muscle, okay. The upper part, the target muscle is a separated muscle. But when you lower, this target muscle is merging at one point. But too much lower, it affected the lower lip. That's why just the 1 cm lateral nostril is ideal point for injection. Okay, is it okay to explain? Any question?
Can you point out once again things, the definition and the concept that we're trying to promote here for the butcher toxins is the premium, toxin. Yeah, would you be able to clarify that for us how premium or how superior is this, in comparison to different other brands?
I'm a clinician, so this is very difficult question for answer, So anyway, I was told the premium Botox is a premium toxin, I think.
In reference to the manufacturing process, it's produced like the freeze drying system that you mentioned earlier.
Yes.
Is that also affect the quality of the product?
Yes, that's right. When you apply the freeze drying system, it takes a whole day. But when you vacuum dry with the heating step, it takes only 1 hour. But why? Why do I have to take one whole day course? Because it has a good result,
เขาบอกว่ากระบวนการผลิตมันแตกต่างกันใช่ไหมครับถ้าคือใช้กระบวนการฟรีซ drying นี่ก็คือใช้การผลิตแค่ประมาณ1 ชั่วโมงเองถ้าเป็นแบบ vacuum drying ซึ่งเป็นแบบเทคนิคสมัยก่อนหน้านี้ก็ต้องใช้เวลา1 วันนั่นก็จะเป็นสาเหตุว่าทำไมถึงครับเห็นว่ามันมี superiority ในเรื่องของ quality ของ product
And also, when you apply the vacuum dry up, it needs a heating system, So, heat means it have a chance to denature the proteins, Yeah. So that means that the Botox has some chance to be denatured.
ผลิตสมัยก่อนมันจะมีเรื่องของยีสต์เข้ามาเกี่ยวข้องด้วยแล้วก็เราอยู่ยีสต์สามารถ destroy เรื่องของโปรตีนเรื่องของท็อกซินได้เขาก็เลยคิดว่ามันน่าจะมีผล Yes please.
Hi. For the necklines, it's intramuscular or you said intradermal, but you have to feel and go muscular, don't you? For the neckline.
Neckline.
Neckline, you mean turkey toe?
Intramuscular or intradermal?
I suggest the intradermal injection is much better because if you shoot deeper than intradermal, such as intramuscular, it causes some problem to your patient, such as the dysphagia. Dysphagia means difficult in swallowing and sometimes difficult in breathing.
ก็จะมีปัญหาเรื่องใช่ไหมครับการกลืนไปเรื่อง affect เรื่องของ swallowing muscle หรือว่าเรื่องของการหายใจ adjusting ก็คือเวลาฉีดพยายามให้โฟกัส intradermally instead of intramuscular injection.
Okay, thank you very much again. Thank you. Kopunka, thank you very much.
Okay.
Okay, take a break 5 minutes, okay? Take a break 5 minutes.
5 minutes break.
Oh, okay.
ก็พัก5 นาทีนะครับ After this we go on to the live demonstration cases.